joining us. My name is Ted Perkins from the Recovery Movie Meetups program, using films and mutual aid formats to help people with both mental health and substance use disorder while they're in corrections. And I've assembled a panel of people to give us an overview of what mutual support has been, where it came from, how it started, and how it's been effectively utilized, and the sort of an impact that it's making in the correctional setting. And I'm really happy to have people who should know much more than I will ever know about this. Nancy Booth is a senior consultant for the National Commission on Correctional Health Care, and she's going to give us sort of like a 20,000-foot view of her role in mental health and the evolution of this whole sector. And then we want to hear from Joe Gerstein, who's the founder of Smart Recovery and also the founder of the InsideOut program, the first mutual aid support system for people incarcerated, to talk about substance use, which has had phenomenal results over the years and was subject to a study done in Australia that had some very, very amazing results, which I'd love for Joe to share. And then Nikki Loder is also implementing the InsideOut program and is also a licensee of the Recovery Movie Meetups program. Let's start with Nancy. And I'm curious to know more, because we didn't really talk that much, but I'm curious to know about your background, how you got into this, and what you think the industry was then as opposed to what it is now. So
Wow,
I'll hand it over to you, Nancy. Thank you.
that's a tough assignment. But anyway, thank you so much. My name is Nancy Booth, and I am a registered nurse by trade, and have been a registered nurse for 52 years. I still work. I love what I do. Um, I go back a long ways. So to kind of condense it, I started out as a nursing student at LA County USC Medical Center. And if any of you know that, it's the big hospital that everybody puts up on their movie site as far as the hospital, because it's huge and it was built in the early 1900s. And I from there I actually worked with inmates. At that time, talk about what happened then. They had a chain around their leg, and they were just in a regular in a regular room, and you'd push them over to the bathroom so that they could go to the bathroom with the door open because the chain was there, and that was it. If you were sick, you were down on the regular unit, which I took. I was their nurse, or we had a hospital actually unit that was a jail unit up on one of the bigger floors of the hospital. So I actually fell in love with working with inmates back then. I did all sorts of things in my nursing. I also really wanted to go into as a psych nurse, and loved the psych experience. We had a psychiatric hospital within our facilities that was actually took all of Los Angeles and combined it into this one psychiatric hospital. Well, as you know, psychiatric hospitals changed a lot. And during the time that I was there, right afterwards, they closed all of the hospitals, and a lot of those patients that should have been institutionalized were now out on the street. But I couldn't get a job in psych once I left. Once I graduated. So I did a variety of things, always having the incarcerated inmate involved in my life. Then at some point, I became a nurse at a brain injured adult facility. And of course, if any of you know what brain injured adults are, psych is definitely one of the issues. Really heavy in that, and rightfully so. So I worked with a psychiatrist there, and we did a lot of behavior management with the medications. At one point then, I became a case manager for an inmate group where I was doing their referrals, specialty referrals to our hospital, and I was their case manager there. So I worked with them on a specialty case-by-case basis, and we did everything. I also did their in-house hospitalization case management, because there are a lot of inmates that do go into the hospital. back in 2006, I joined San Diego County um, Sheriff's Department and was their infection control nurse, but then became a supervisor. And the supervisor was within the women's facility, which had an inpatient psychiatric hospital. So we had that. And then I became the director of nurses for San Diego County, and we had actually two psychiatric hospitals. I know I'm preaching to the choir, but mental health is one of the biggest things that we see that between that and substance abuse. That's about all of our patient population right there. And frustration of getting them into a program and then keeping them once we've moved out in the community, trying to get that continued. Good news is with a lot of the things that are happening, the MAT program has helped to link some of our patients out into the community. If we're doing induction, it's probably the first successful thing we've been able to do, because most of those people, that program wants to help those that are incarcerated. Not very many people want to do that. They want somebody that's had clean living up until that point. And we are a population that there's a lot of incarceration. Since I retired from the Sheriff's Department, I have done a lot of consulting work, both mental health and medical. I've done all sorts of stuff. And when I saw the curriculum, it made me kind of think about how I have used curriculum in the past we haven't used it for patients, but we've used it for training our nurses and our deputies. And I was thinking about, we talk about substance abuse and there was one where delusional, and it was some clip that we did with Nicolas Cage in a casino, and I don't even remember what it was, but we use clips like that to help our nurses and our deputies see what it's like. And when I then heard about, wow, we're taking this on to the patient care side, I was intrigued. Personally, my dad was bipolar. We have a lot of our children that have issues, a lot long-standing mental health. We're all treated, but I mean, what could I say? But again, mental health, as we've gone forward, has become somewhat, and I use the term somewhat, more acceptable. But back when I first started out, it was a locked ward, and you medicated till they were almost completely, catatonic. And nobody ever talked about mental health. If you had a family with mental health issues, I have to share with you that my granddaughter had issues. I think she started at 8 or 9, and they actually did a TV special on her because they were talking about suicide, and she was talking about how important it is to let somebody know and whatever. So we embrace that. It's not something that needs to be, shameful. And again, anything that we can do, mental health is a sad thing. It takes the family down. And so again, anything we can do, anything that's relatable so that people can look at it and not say, gee, that's that person, but not me, I think is going to be important. So again, I'll get off my soapbox, but I'm excited to be here.
I actually wanted you to get on a soapbox. I think it's important for the community to know. And can you recall that first time that you were in a mutual support meeting format in a correctional institution and you saw sort of the magic happen and what that was like, and how, it was like a different, more innovative way of getting people to really engage, and what the result of that was like for you?
Well, I actually saw an engagement really when I was back even at LA County with a group of therapists that were very, very good. And of course, some of these people were court ordered to be there. And, we don't have enough professionals to continue with our correctional facilities. So we always have to bring in new ones. And that means that they've never been in corrections, and there's a quick learning curve that everybody has to have. So it's kind of an ongoing thing. When you see somebody finally click in, it's so exciting to see that they get it, and I heard one person say one time, it's enough that they're here, that and incarcerated. We don't have to be the ones that punish. And again, I always say, there by the grace of God go I, or my children, because a lot of people don't have weren't blessed with great parents and all the other things that go with that. So it's fun to see, if it's not on a collaborative basis, to see that click go on in somebody that all of a sudden has a passion and gets it, and a lot of times, correctional health in general is it's the best kept secret among medicine, as far as I'm concerned. So people just don't realize that people in jail have got medical and mental health issues, and that we have to treat them. So again, it's more on a case by case basis when you see the light goes on, and it's once you've got them hooked, you got them hooked for life.
Wonderful. Thank you. Thank you, Nancy, for sharing all that with us. Well, let's move over to Joe Gerstein, who a mentor of mine, a friend, the founder of Smart Recovery, basically one of the leading, as you all know, one of the leading mutual support meeting formats, next to AA and LifeBring and all the other ones, but one that helped me also in my sobriety tremendously. And also a teacher at Harvard Medical School, a doctor. And Joe has got incredible experience in the mutual support side, but then expanded his reach into the correctional setting through the InsideOut program. So Joe, tell us how this came about, how you applied to the NIH, how you got it going, and where you're at now, where meetings are starting all over the world and you don't even know about it. And it's that popular.
When I started Smart Recovery, at the time called Rational Recovery, April 1st, April Fool's Day, 1990, never intended to get deeply involved. Very busy with my clinical work, my teaching work, and busy practice and everything. But without going into the details, I got involved. I ran my first meeting, which went terribly. I didn't know what I was doing. And at that time, these were called self-help groups. Now, of course, we know them now as mutual aid groups. And the reason for that is the academic articles over a period of time, which demonstrated conclusively that the cohesion of the group, the support of the group, was often the most important element in a person's recovery, more important than the tools even. Now, we have our new handbook just came out. It has 16 tools in it. We had 14 in the third edition. Now this is the fourth edition. We threw in 2 more. But the group support is absolutely an element in the recovery process. Now, I got into this tangentially because one of our best facilitators got put in prison. And one of the people in his group called me up and said, "Hey, Joe, Nat is in Concord prison." I said, "What's he doing there?" Well, he had a cocaine problem. He had an old charge, maybe 3 or 4 years old, but he had a mandatory sentence. He was completely out of the woods, but he had a 3-year mandatory sentence. So I went in to visit him. And he said, "I have good news and bad news." I said, "Well, give me the good news first." He said, "We can have a Smart Recovery meeting here." I said, "Great. What's the bad news?" "You have to run it." He said, "What do you mean?" "Well, they have to have a volunteer do the program. They won't let an inmate do it." So anyway, my wife actually got started. And then she said, "I want to do a women's meeting. I want to start a women's meeting." So I took it over, and that since then I've done almost 800 meetings in prisons and jails, and it's been quite a revelation, like your experience, Nancy. Now, I remember my first meeting there. There was a guy in the front row you wouldn't want to meet in a dark alley, what you would call a yeg or a thug. And during his check-in, he said, "Nobody disses me and gets away with it." He's built like a linebacker in the NFL. It scared me, for God's sake. Anyway, he was in the program for about 3 months, and then he came up. He said, "I'm being released on Monday." I said, "Great, maybe you can get involved in one of our meetings." There were no online meetings at that time. And about a month later, his name was Billy. About a month later, I got a call from a woman because the Smart Recovery phone was in my kitchen. And she said, "I'd like to become a facilitator." And I said, "Well, what impelled you to do that?" She said, "Well, I'm Billy's girlfriend." I said, "Oh yeah, I remember Billy. How's he doing?" She said, "He's doing great. He's doing wonderful. That's why I want to become a facilitator." She said, even my mother likes him." Now think about that. I mean, that's the ultimate compliment, right? Well, anyway, she never did become a facilitator, but that was my first experience about how the power of the program and the group could change someone drastically. Now, people at Danbury Prison for Women heard about what I was doing, I guess, at some conference or other. They exchanged information. And I was just using the regular Smart Recovery program at that time. And they invited me to come down there and introduce it. And I went down there with my wife and a social worker. And we trained their 3 treatment personnel. And then after lunch, they gave us each 10 women to run a meeting, and one of their people sat in and watched the meeting, and that was it. And after that, they gave women a choice. They isolated them, 100 women, and they spent a week in didactic programs about AA and Smart Recovery, and then they let them choose. And about half choose each, actually 45, 45. And 10 said, well, we want to go with Gladys, or we want to go with Zelda, our friend. That was more important to them than what program they were in. Well, I never could find out exactly what went on there, but about 6 months later, I was invited to train 100 treatment personnel from the federal prison system in Charlotte. And I went down there, and I didn't charge them anything, just my expenses. And I spent an all-day training. We had no training program at that time. And then 2 months later, I guess they must have liked what they heard, invited me to do the same thing to 100 treatment personnel at Norfolk, which I did. And then I didn't hear from them for 5 years. And I met at an ACA conference, the man who had originally invited me to Danbury, and we were eating lunch. And I said, by the way, whatever happened with the federal prison system? He says, oh, they stole your program. Didn't you know that? Okay. Well, that was a bit of a shock, but it did. They made a few minor changes, but basically it was our program. It wasn't copyrighted what I taught them, so that's what happened. Would have been nice if they gave us $1 a copy royalty or something, but that's the way it went. So at that point, I said, well, we have to get a copyrightable program that we can monetize. It's a non-profit, but got to have some money to run the organization. So that's when I applied to NIDA, and we did a preliminary program, which was the highest rated preliminary program they ever had at NIDA. 20 people review it, and they all give it a grade. And then we got $1 million to do the InsideOut program, which is now all over the world. Also, we have broken it down. InsideOut program is a 24-meeting program, and that's too long for jails. So we have a jail program called Learn Smart Inside Out Fast, and that's 12 meetings. And then we've broken that down even further to a program called Successful Life Skills, which has fourth grade readability level and also has a job skills module and a financial management module. And we've used that all over the country. We've done over 200 sober homes with a grant from HRSA and another grant from Elevance Healthcare. And it's in all the Texas prisons and so forth and so on. Now, what about this group effect? Well, we introduced InsideOut into, of all places, the Inverness, Scotland prison. Now, a corrections officer of the Inverness, Scotland prison came to New England to visit a friend of his who was a corrections officer at Concord Prison, where I was doing the Smart Recovery Program. And he called me up from Scotland and said, will you come and introduce the program here? Well, my wife is of Scottish extraction, so that was a good way to get a tax-deductible trip to Scotland. And we showed up and we did a few meetings, and then we did an all-day training in the city itself for social workers and psychologists, and then we toured Scotland. And I think I arranged a talk at the Royal Edinburgh Hospital. It was quite receptive to what we were doing. And also, I came back, they called me and said, come back 2 years later. We want you to go to Aberdeen and Glasgow and the Corn prison, which was the women's prison. And when I arrived at Inverness, they said, the governor wants to see you. So I assumed that the governor was person of importance at the prison. And they trotted me down his office, sat me down opposite his desk. And he leaned over the desk. He said, Joe, I have never seen anything like this in my 20 years in the Scottish prison system. How would you like to get an unsolicited testimonial like that? So I said, well, what's going on? He said, do you know that the corrections officers came down here and demanded to be trained as facilitators? I said, no, I hadn't heard that. Anyway, the next year I was the keynote speaker at the Scottish Prison System annual conference, and all 9 Scottish prisons adopted it. It's now been running ever since in 80 of the 89 UK prisons. However, they did initiate a very important program. They trained inmates to be the facilitators. Now, in the beginning, they made the mistake of not training long-term, so they got a lot of turnover. Then they wised up. They said, no, we're only going to train people with long sentences. And that's been going on ever since. Now, we have a study. I'm not going to go into the details on it, and it wasn't with InsideOut. It was BI, before InsideOut, but it was in the New South Wales prison system in Australia. My wife's Australian by citizenship, and we introduced it there in '95, and the prison system called on a trip in about 2000. We introduced it, and they started using it. Started using Smart Recovery, not InsideOut. 10 years later, I was on the board of Smart Recovery Australia for 12 years. Had to get up at 2:30 in the morning to go to the meetings. But I was sleepy-eyed, and 2:30 one morning I got up, and they said, well, we got a paper from the New South Wales prison system. Chris Blatch is going to present it. So what was it about? A study on 6,000 inmates. 6,000 with addiction problems, 3,000 who received some Smart Recovery, and 3,000 who had 5 other programs. Now, they follow the primary effect that they were studying was reconvictions, not recidivism, not, they didn't show up to a parole appointment or something, reconvictions. after release. And they had data going back for some of them eight years. And I won't go into the details of the study, very complicated, very well done study, what's called a propensity controlled study. They matched inmate for inmate with 21 different parameters to make sure they were similar, and then they followed them. And they were able to do about 2,875. They got a match, and those were the people who were studied. And the best outcome was the people who had attended 10 smart recovery meetings. Their version of our handbook called Getting Smart, which had cartoons in it, in addition to the handbook, and then followed up with smart recovery, regular smart recovery meetings, 42% reduction in convictions for violent crimes. 42%. Not one of the other programs had any statistical benefit. And the benefit went up. They measured 2 meetings, 4 meetings, 6 meetings, 8 meetings, 10 meetings. The benefit accrued to each group percentage-wise till they got up till 10. And then it flattened out, and that was it. All 10 meetings got them the maximum benefit. Pretty amazing study. Now, the study was the InsideOut program was introduced into a Maryland prison by a social worker. She actually bought the first package herself. She paid for it on the eastern coast of Maryland, and was apparently very effective. They moved her up to the biggest prison in Maryland, Jessup Correctional Institution, 4,000 inmates, what's known as a black hole prison, a lot of young inmates with long sentences. She trained 38 inmates as facilitators with our help. And then she instituted the program, which was incredible. Changed the whole prison. There were 50 suicides the year before it started, 5 the next year. So it was an incredible thing. She sent me letters that the facilitators wrote. I took the best 5 and sent them to Nora Volkov, the director of National Institute of Drug Abuse. I said, well, I'll probably never hear from her. 5 minutes later, she wrote to me and said, I want to talk to this social worker. So she arranged for the social worker to go. I said, you take with you the parolee who you had talk at one of our conferences. So she went with the parolee. The parolee was selected to be the keynote speaker at the award ceremony for National Institute of Drug Abuse. And then I was invited to come and talk about just what I'm talking to you about now, the whole spectrum of the smart recovery, correctional trajectory, which is all around the world, all the Canadian federal prisons, 30,000 copies ordered every year by the California prisons, and so forth. So that's it. I guess we've arrived. One of the 3 articles in the New England Journal of Medicine this year, that is since January, there have been 3 articles on addictions. All 3 recommended smart recovery and AA as evidence-based programs. And one of them was about incarcerated people and the importance of treating incarcerated people and people in reentry. And the lead author was Nora Volkov. The second author was John F. Kelly, professor of addiction medicine at Harvard. And the third author was Howard Koh, professor of public health at Harvard and former secretary of health in the HEW. So you can't get any more illustrious authorship than that. And they came down in smart recovery. So it's a perfectly acceptable and reliable and beneficial program. I think that's very, very clear now. That's what incited Nikki to get involved with it in South Carolina. And okay, I just want to say also that Ted's program, which is, of course, uses movies, is a mutual aid program, because after the movies, there's discussion. First of all, you have to fill out a form about what you thought about different aspects of the program. So it works just like any other mutual aid program, and then you discuss it. There it is. So as far as I'm concerned, it qualifies as a mutual aid program. It's very, affirmative, very accessible, and fun, and interesting, and so forth, and entertaining. So I think I've said all I should say. I don't want to encroach on Nikki's time. So
no, Joe, that was terrific. Thank you for that perspective. I mean, just knowing that whole story of how it's really helped and how it's worked and everything, and that gives us a lot of courage to keep promoting our program as well. And obviously learned so much from you, and very proud to have you on our board of advisors. Now let's go to Nikki, who's now a person who's implemented the program, gone through all the training, is both using InsideOut and also is going to be using Recovery Movie Meetup. So I wanted to get sort of like the view of like on the ground, how it's working, how it's doing, what your whole story was. And if you could share that with us, I think that'd be terrific.
Sure. So my name is Nikki Lowther, and I am first and foremost an individual in long-term recovery myself. And so an individual being in recovery, these two platforms, and like Mr. Gerstein said, both of them, we use both of them, and they're both mutual aid, and I can't even express, and I'll go into some detail about how we use them within the South Carolina Department of Corrections, and it's really been a game changer for us. I've been with the Department of Corrections for 4 years, and just to put some things into perspective, we have 21 prisons in the state of South Carolina. We serve, at any given day, we have about 16,000 residents. We have 250 to 300 returning to the community every month. And so with that being said, mutual aid groups are the cornerstone of our prison setting, and it cultivates like a sense of community for some that never even had one, right? And so the psychological healing and the tools that are necessary for reintegrating back into society are just amazing. And so I feel so blessed to be on this panel with the three of you amazing trailblazers. I don't know how I became so lucky, but we are really thrilled to be utilizing both programs within the Department of Corrections. We started a program, our MAT program started in 2017, and we realized that we were still having positive drug screens come back at the rate that they were in the community. So we knew we needed to do something different. And so we started to think about what could we do, and we decided to utilize our best assets, which are our residents that could provide hope to others. And so with the backing of state funding, the opioid settlement funding, we put a program together with various partnerships for peer support, certified peer support. And so we were able to pay individuals in the community to come in and train our incarcerated population as certified peer support specialists. And at the time, we trained 100 individuals, and that was up until 2021. And then we just started seeing just the great impact. And so after, with COVID coming into play, there was definitely a lot of challenges. And so we decided that we needed to do something else to be able to sustain this and to grow these programs. And so we started looking at what could we do, and could we actually have some conversations about bringing that certified program inside the prison instead of spending the money on renewing continued education, and can we actually bring it inside and train our own population? Well, our addiction professionals of South Carolina allowed us to do that. And so in November of 2024, our 100 peer support specialists alongside of me were able to, we've been able to train and certify other incarcerated individuals so that they too can become certified peer support specialists. So we've trained 45 in the last year, and we've also trained 100 in June, it'll be 180 on the SMART InsideOut program. And so that program is in 12 of our institutions. It does us great justice for filling in gaps as far as like with the connection, the power of those multiple support groups lies within that connection of these individuals, offering that hope and encouragement. We see vulnerability especially with the diversity of those experiences. As you know, each individual's journey is unique. So hearing those various perspectives, it enriches the group's experience, and it can definitely bring broader insights into recovery and provide different coping mechanisms. It builds trust. So developing that trust among those individuals are fundamental. And a couple of things I love about the InsideOut program is that we're able, after the 12 weeks, we're able to actually offer a certificate, and it's able to go into our system so parole can see that what they're actually doing. And we have individuals that continue to want to start, attending additional groups. So I've done this, what else can we do? And our peer supports are the ones that we've trained. We've trained 100 of our peer support specialists. We've trained 50 of our additional residents that have been group leaders as being SMART facilitators. And we've also trained 30 of our SCDC staff members and mental health professionals so that they can too understand and also help to have topics to run their groups. So it's just really an all-inclusive turnkey that we've been able to utilize with these groups. The tools that are in the InsideOut, we've been able to incorporate in other parts of our curriculum to supplement, like say we're doing, talking about returning to use, and there's some different exercises in there that can help strengthen those types of things. And also, the same with Ted's program with the recovery meetup, like utilizing his movies and his program. We've done it as a reward system, an incentive for participating in different groups. We've done it as a teaching avenue to facilitate life skills. A lot of the times also about exploring different pathways. So we use it as a tool for sure, and facilitating those discussions. Sometimes this is the first place that individuals are able to process these emotions. They don't know what it looks like. They didn't even realize that they self-identified as somebody that had an addiction. And unfortunately, prison for a large part of our population, this is the first time they've ever sought treatment. And so when treatment can look different and can take different pathways, it's more enticing. And the best thing about it is most of our programs are run throughout the day, and there's definitely structured groups that have to happen in some of our programs. And so it doesn't leave a lot of time for other things to happen. So off hours, these groups, the SMART facilitator groups, and then as well as the recovery meetups, can happen in the units themselves. They don't have to have staff available. They're run by our peer support specialists, so they can fill in the gap. They can continue that recovery journey even after hours on the weekends. It just, both of those and both of them together are just really powerful. They bridge the gap for us, and it just promotes a very hopeful outlook for integrating back into the community, or even just the behavioral difference that we see. Just thinking about things and giving individuals an opportunity to actually sit back and especially with the movies, Ted, where they can say, oh, well, if they're returning back home, and they can say, well, I never thought about doing this, or I never thought about taking this approach, or they have a visual that they can remember of a character and incorporate that into their life. And it just really speaks volumes about both of these programs that we love dearly and are really doing big pushes. Now, we don't have outcomes yet, but I'm excited to bring outcomes. Maybe I need to hire Miss Nancy to teach us how to do these things and and help us in that direction. So, but we're hoping to actually have a big push of both in September and roll it out. Although we're already doing them in 12 institutions with our peer supports, I would like to start getting some outcomes on it because I know it's beneficial. We're hearing from the residents. We hear so much great feedback. So I'm appreciative of all of you guys. So thank you so much.
Thanks, Nikki. I'm so glad to hear all that. That's wonderful. You will have outcomes shortly. Try to find somebody from a local graduate school who wants to do their dissertation about it. That might be a good idea. That would be a juicy thing to do a dissertation about. And so to all of you, thank you so much. Joe, it's so great to see you. And Nancy, we met very briefly, but I just had this great vibe about you, and just your experience is phenomenal. And I hope we get to do more things together. So thank you for generously donating your time today. And the same thing for Nikki. Let's keep on, changing the world together. All of you, thank you so much for joining. And